In the front row, we have Connie, Mike, Ice, and in the back row, we have Damien and April, and my mom, Paula, will be videotaping. My topic here today is empathy and communication in the field of nursing. My specific purpose is to inform my audience about the difference in empathy and communication and how they both connect to the nursing field. Empathy has a thin line when it comes to nursing, while communication is necessary. Empathy and communication are two necessary tools in the field of nursing, but are best when limited. Empathy is defined as the quality or process of entering fully, through imagination, into another's feelings or motives. Both oral and written means of communication in the field of nursing are crucial. Today, I'll discuss the importance of different communication guidelines nurses have to abide by in order to separate the line of empathy and communication. First is social guidelines. A nurse's social interactions are to be what is considered safe. They should not overstep their boundaries into personal interactions with a patient or doctor. They should be courteous and friendly, but try not to become too personally sociable with the patient or doctor. It is important to remember that nurses need to maintain their friendship with patients professionally more so than personally. A nurse may get too attached to a patient if they are found to be with any negative, damaging health issues. It would be very unprofessional for a nurse to show too much empathy for a patient. Of course, some nurses may have a small attachment to the patient. That is normal. But because many patients die in the field of nursing, it would mentally disturb a nurse to get involved and attached to many patients, and for nurses to have to repeat the grievance process over and over. So boundaries have to be drawn, as Peggy Smargiassi, RN, states. Secondly, a nurse's approach should be what is considered structured. That is, their communication skills involved either interviewing or teaching a patient. When interviewing, they are to take the required information needed to do their job done effectively. When teaching, they are to inform the patient and those involved with the patient what needs to be done in their regimen to help regulate their health needs. Recently stated by a RIA patient health spokesperson, patients brought into their waiting room must be checked on more often. Like I stated before, boundaries have to be drawn and the nurse will have to decide where those boundaries lie. Touching is also an empathetic way to show emotion. A simple touch may let the patient know that you care. If a nurse is not as effective as the medical hierarchy would expect, other ways to express that care and understanding include both body language, hand gestures, and facial expressions. Also, nurses are the communication line between doctors and patients, so they have to have the listening skills to match the speaking skills, because in communication, listening and speaking go hand in hand. Third is a therapeutic way of communication. The nurse is expected to be patient-focused for a specific period of time constraints until the patient is done treatment. They have to be purposeful in relation to the patient. This involves setting a context up between the patient and themselves in which care can be provided to the patient in a timely manner. They must have the patient's trust to make their communication effective. This way they can convey the information needed to identify, resolve, or help the patient adapt to their health situation, as mentioned by Fran Charlotte, RN. In order for this bond to occur, both means of oral and written communication has to be established. All communication must be clear with no misunderstandings to ensure the patient the best treatment possible. In order to communicate at best, it is wise not to be overworked and tired. Tolerance must be high to communicate effectively. Do I have any questions?
Yes. Do you think you need empathy to communicate as well as to communicate effectively?
Yes, I believe you need empathy to communicate with anybody, because it just shows that you care.
Okay.
Any other questions? Do you think it works? Yes, I think it definitely shows a difference in patients, because someone cares more if you show that you care. conclusions, communication must be a clear message sent from the speaker to an audience. The messages in the nursing field are crucial to be received. Nursing has a very thin line between empathy and communication. It is a fine line on where to draw the boundary on a nurse-to-patient relationship. But with the simple guidelines of social, structured, and therapeutic ways to communicate, communication in the nursing field should be simple. Also, communication is at best when the mind is refreshed and clear to think straight. As to review my main 3 points, I've provided the PowerPoint. Communication guidelines have to abide by in order to separate the line of empathy and communication in this field. The main points. First one, social guidelines. Secondly, structure. Third, therapeutic. I'm Amanda Burney, and this is my speech 1.